you are watching the news from the Sultanate of Oman television. First, the headlines. A report issued by the Ministry of Health on the country's epidemiological profile indicates that the infection rate of COVID-19 is declining. The National Multi-Hazards Early Warning Center indicates the formation of a tropical depression northeast of the Arabian Sea, while the civil and military bodies affirm their preparedness to deal with the condition. And the deadly blast in Beirut kills 137, injures more than 5,000, and rescue workers continue to come through the rubble for the missing people. Those were the headlines. Now for the news in detail. His Majesty Sultan Haytham bin Tariq sent a cable of greetings to His Excellency Dr. Al-Hassan Abdulrahman Ouattara, President of Côte d'Ivoire, on his country's National Day. A report issued from the Ministry of Health on the country's epidemiological profile indicates that the infection rate of COVID-19 and cases admitted to hospitals and intensive care units began to decline. The report, which was prepared by the Directorate General of Disease Surveillance and Control on the epidemiological profile until the end of July, showed that the average case infected by COVID-19 in the first week of July reached 2,000. But the infection rate gradually declined to 1,000 by the last week of July. The infection rate dropped by 500 cases on a weekly basis. The report also stated that a series of population-level parameters will be adopted to observe the epidemiological situation in the country and plan for the next stages in cases of a potential outbreak and an increase in the number of admitted cases in the hospitals and intensive care units. The parameters will be used on data acquired from acute respiratory disease surveillance centers established in various governorates, the National COVID-19 Serosurvey, and the daily mortality rate per 1 million population. The data will then be compared against mortality rate in the previous years. The Ministry of Health announced 4 deaths of COVID-19 patients, which brings the total number of COVID-19 fatalities in the Sultanate to 492. The ministry also announced 427 new confirmed cases of COVID-19, which brings the total number registered in the Sultanate to 80,713. The Ministry of Health stresses that 70,910 cases have been recovered. Al-Nahda Hospital healthcare frontline warriors, doctors, nurses, paramedics, and other healthcare staff in the battle against COVID-19 are all working hand in hand, providing essential services and exerting their efforts to contain the outbreak of the coronavirus. More details in the following report by Abdullah bin Ahmed Al-Rubayyi.
Al-Nahda Hospital, one of the main hospitals in the Sultanate fighting against this colossal pandemic. With their PPE seen here, a frontline healthcare staff team of Al-Nahda Hospital dedicated for COVID-19 patients. These are doctors, nurses, and other healthcare teams, all of whom work tirelessly to provide quality care for their patients 24 hours daily from the time they have initiated these specific services in the hospital.
Al-Nahda Hospital has been on the front line of the COVID-19 fight since February 2020. We started with 1 COVID ward, and now we have 3 COVID positive wards and 1 A&E special for COVID patients. We have been working hard during this Eid to help our patients. We know it has been a difficult Eid for both our staff as well as the patients. We want the relatives of the patients not to worry because we, Al-Nahda staff, were here to care for them.
Al-Nahda Hospital is one of the main hospital tasked with the great national cause of COVID-19 patients, beside other areas of hospital specialty of medical and surgical in ENT, ophthalmology, dermatology, oral maxillofacial, including internal medicine.
In Al-Nahda Hospital, we have 3 dedicated COVID wards, and most of the admission patients nowadays are more than 50% are elderly people with comorbidities. But comparing the seriousness of the illness to March and April, now the seriousness of the disease is less. But having said that, we should keep social distancing and hand washing is the must.
We are committed to do duty during the Eid, regardless of our personal circumstances. As everybody knows, most of all COVID patient is admitted in isolation ward. So we thought to support patients psychologically and celebrate the Eid with them, to be like one of their family member.
It's worth mentioning that the hospital management prepared to fight against this colossal pandemic as soon as the first corona case virus was detected. After mock drills and dry run for specialized treatment, the first ward of 20 beds and a high dependency beds were ready, receiving COVID-19 positive cases.
Actually, we have been working in Eid without changing in our schedule. So we spend our time here in the hospital, and it has been a bit stressful time, but we are a bit committed to it, and we used to work in this stressful situation as well. So please, for us, stay at home, stay safe, and we hope this lockdown will get a good results soon, inshallah.
As a healthcare worker working during Eid and far from our family, so we understand the patient feelings that time. We consider them as our family. So as nurses, we are treating them emotionally and physically.
The hospital also had streamlined numerous processes such as isolated designated areas as well as emergency unit where whole sites specifically allocated to operate on screening process of suspected having the virus and treating positive patients. They have managed also to get additional staff from other areas to fully work in COVID wards. COVID-19 testing made available 24 hours with the results coming from the same hospital. Once again, the action was taken as soon as patients with COVID-19 continued to increase in the country. 2 more wards of total 48 beds each with specific high dependency beds were allocated all together. That makes a total of 68 beds, which are now 60% occupied by patients with coronavirus. This is the challenging phase for not only the country, but the whole humanity. We have seen how the number of COVID-19 increased in the Sultanate and how the frontline healthcare workers exert their efforts round the clock here in Al-Nahda Hospital and around healthcare institutions in the country. Their time will only be brightened when they see the whole community is behind them, sticking to the preventive measures of which will cut down the coronavirus. So be committed to the preventive measures, save lives, and stay healthy. From Al-Nahda Hospital here in Rui, I'm Abdullah bin Ahmed Al-Rubi'i, Sultanate of Oman Television, Muscat.
The latest analysis of the National Multi-Hazard Early Warning Center indicates the formation of a tropical depression northeast of the Arabian Sea from today evening, which may lead to cloud accumulation on the governorates of Muscat, South and North Sharqiyya, Dakhiliyya, South and North Al-Batina, Dhahira, Buraimi, and Al-Wusta. Varied intensity rainfall estimated from 40 to 100 millimeters are expected for every 24 hours, reaching its peak on Saturday. There are also chances of occasional thunder showers that may lead some wadis and their tributaries to overflow, accompanied by gusty winds on the desert and open areas until next Monday. Seas will be rough along most of the coast of the Sultanate with a maximum wave height of 3 to 5 meters. The Public Authority for Civil Aviation advises public to take precautions during rain and not to cross flowing wadis and check the sea state before sailing and follow the latest weather bulletins. All civil and military institutions stress their complete readiness to deal with the tropical situation that is expected to affect the country. Sultan's Armed Forces stated that it has taken all measures to prepare and be ready to contribute to deal with the tropical situation by activating its plans and response accordingly. Sultan's Armed Forces will extend its assistance to government institutions and will help citizens and residents in affected governorates and wilayas through military emergency management subcommittees. The Ministry of Regional Municipalities and Water Resources said that it has formed field response teams in the affected governorates. The ministry will provide equipment, pumps, and water tankers to open the roads and draw excessive water, and will continue to observe rainfall monitoring stations to ensure the readiness of the dams. The Ministry of Agriculture and Fisheries Wealth called upon all farmers, animal breeders, and beekeepers to take the necessary precautions to ensure their own safety and the safety of their livestock and beehives by keeping them away from wadi streams and low-lying areas. With some 300,000 people left homeless by the massive explosion in Beirut and fears of food and medicine shortages, Doctors Without Borders (MSF) today likened the humanitarian fallout to that Lebanon's civil war. The MSF president Migo Terzian said that after the initial rush to treat the injured, the next priority would be to provide food and shelter for the destitute. Terzian said warehouses storing medicines and vaccines in the port of Beirut were damaged in Tuesday's monster blast. The provisional death toll stood at 137, but dozens missing and 5,000 wounded. The number of victims was expected to rise as rescue workers continued to come through the rubble. Terzian said Qatar, Kuwait, and Jordan were sending field hospitals, and attempts were being made to guarantee the supplies of basic medicines such as antibiotics, painkillers, and blood bags. French President Emmanuel Macron met with Lebanese leaders during his visit to Beirut today, 2 days after a giant explosion rocked the city. After reviewing the site of the blast and meeting security workers, Macron did a walkabout in the streets before going to Abda Palace, where he met with President Michel Aoun, Prime Minister Hassan Diab, and Speaker Nabih Berri. Lebanon mourned today the victims of the most powerful blast to hit the country that was already being crushed by an economic crisis. Macron's office has said that France was sending 55 security personnel and 6 tons of health equipment, and that around 10 emergency doctors would fly to the city. At least 10 people were killed and more than 3,300 homes ruined by flooding triggered by rains across much of Sudan this week. Some 1,800 homes were completely destroyed, while just over 1,500 were partially ruined. 21 schools and 8 mosques were swept away. The UN said that more than 50,000 people had been affected by the flooding. Downpours in Blue Nile State caused the dam to collapse on July 29th, destroying or damaging 800 homes and potentially comprising access to water for over 84,000 people. Heavy rains across South Korea raised concerns of more floods and landslides today as parts of the major highways have closed in South Korean capital of Seoul and hundreds of people remain displaced. In Seoul, the Han River swelled over its banks in some areas after authorities were forced to open floodgates on upstream dams. Some highways by the river had to close. Parts of South Korea have seen 44 consecutive days of rain, the longest monsoon since 2013, and continued showers across the Korean peninsula threaten to bring new floods and landslides. At least 16 people have been killed and 11 were missing, with more than 1,600 people displaced over the recent days. Yesterday, Prime Minister Chung Sik-yeon visited some of the hardest hit areas and urged the government to consider proposals to designate several province special disaster zones. The coronavirus pandemic has killed at least 708,236 people worldwide since it surfaced in China last year. There have been at least 18.8 million cases registered in 196 countries and territories. The United States has recorded the most deaths with 158,268, followed by Brazil with 97,256, Mexico 49,689, Britain 46,364, and India with 40,699 fatalities. Australia's second largest hit city enters the country's toughest lockdown yet. Melbourne's streets are visibly quieter as non-essential businesses are forced to shutter under the new rules expected to be in place for 6 weeks. 3 health workers in a displaced persons camp in northeastern Syria have contracted the virus. The United Nations say that the first reported infections in the vast tent city that is home to tens of thousands of people, including relatives of the Daesh group militants. Poland will reimpose compulsory face masks in all public spaces in 9 districts, amid a record new high in the number of infections. This is the Sultanate of Oman television. Before we enter tonight's news bulletin, here are the main points once again. A report issued by the Ministry of Health on the country's epidemiological profile indicates that the infection rate of COVID-19 is declining. The National Multi-Hazard Early Warning Center indicates the formation of a tropical depression northeast of the Arabian Sea, while the civil and military bodies affirm their preparedness to deal with the condition. And the deadly blast in Beirut kills 137, injures more than 5,000, and rescue workers continue to comb through the rubble for the missing ones. With that, we come to the end of tonight's news bulletin. From all of us here at the newsroom and the studios, thank you for watching and have a good night.